Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to the Half Off Health program. And tonight, as always, we are going to bring you some information that I know, if you really pay attention, will change your life. Are you ready, Deb?
I am ready, Dr. Bob, and I'm very excited because as I look, we have a limited amount of props tonight in comparison to where we usually go. So where are we going?
Well, Deb, you know it's so fascinating. We have been involved in natural health care personally when I started my training 1974. That was before VHS tapes. That was before cell phones and the internet. There's a lot of people that are watching us right now that weren't even born yet.
Right.
That was like the whole other millennium.
Right. Well, even computer.
I know, it's so phenomenal, but what's so amazing to me is what we're going to talk about tonight is the basics. You know, gravity continually and relentlessly pushes down on top of us. And we have so much technology today. They are creating stem cell tissues. They have a drug for everything. They can replace almost any joint inside of your body. But when it comes down to the reality of life, is very simple. Now pay attention. Your brain sets in the skull. The brain continues on inside of the spine. The spine is made of 24 movable parts. That means the spine can move. The spinal cord, which Debbie is going to hold for me right now, is analogous to your printer cable. And I'm kind of chuckling, Debbie, because we have a printer right now that's wireless.
Right.
So there'll be a time that we won't even have these cords anymore. So this cord, this printer cable, is inside of your spine. We know that the spinal cord is very important because it's encased in bone. Now watch this, because we have patients that come into our office all the time. I recently had a young lady came into the office that was involved, now listen, in a motor vehicle accident 13 years ago. So when somebody comes into our office, we always look at their posture, Deb. So let's say this is the left side right now. So let's say that you would get hit from the side in your motor vehicle and your head goes this way and back this way and then backwards. That's what a whole whiplash is. Well, over time, if somebody comes in, and I notice when we do the postural assessment and their head is shifting off to this side, chances are they have misalignment and or subluxation below that area that oftentimes is caused by trauma. Soccer, so when they do this with their heads, you know, soccer, playing football, you watch how much trauma today. They're talking about these guys that are dying. Even cheerleaders, when they jump off the ground or off of a mount onto a ground or falling off of your bicycle, causes the spine to go out of alignment, creating subluxation that stops your body from functioning.
So what does that mean, Dr. Bob? Stops my body from functioning. How do I relate that to maybe a bowel issue, that I have something going on? Maybe I'm constipated or I have diarrhea or even indigestion.
You know, Debbie, it's a basic principle. Your brain, which sits in the skull, are you ready for this? Sends out 28 billion, that's bravo, billion emails every day telling the body what to do. So your brain is constantly sending information, assessing information, sending the information. So let's say that the colon is right down here. Well, we know that that message will go down here to the first lumbar vertebra. So this part of the spine is called the cervical. This is called the thoracic, and this is called the lumbar part of the spine. Well, the first lumbar vertebra has the responsibility of sending messages to the colon. And oftentimes, Deb, we'll find individuals that might be firefighters, nurses' aides, work at manufacturing plants that require bending, twisting, and lifting, causes this particular vertebra. So when somebody comes in with that occupation, that's a cue to me that they may have decay in that area. Decay is when the bone itself starts to settle down and the disc starts to deteriorate, putting pressure on the sensitive nerves that actually go to the colon. Deb, it's not uncommon for us to have someone come into the office, have been constipated, I know this might sound silly, for 30 years,
Wow.
I know, it's a long time. That's a lot of poop.
That is
Anyways, but what they're doing is they're taking a laxative to trick the nervous system. Let me, there's so many things. I'm just thinking about all the stuff I could be telling everybody right now. So your brain sends a message down. You were raking leaves, shoveling snow, putting mulch on the yard, doing whatever, washing your car, and you irritated that particular vertebra right there. You might not think about it, but you maybe notice your bowels aren't functioning optimally, or you have a little diarrhea, or we could take up a little bit higher and you have a subluxation at your thoracic or your mid-back vertebra, and you have digestive distress. You don't put the two together. So this goes on, Deb, not only for a week, but maybe a month or a year. You start to live with your problem. You start to live with the challenge. You go to your healthcare provider. You say, I'm having this challenge. I don't know what's going on. They don't think about asking you what you were doing at the time, like I fell off the back porch and I injured my spine. Because, see, if this is out of alignment, your colon's not going to work. So you'll go to your healthcare provider, and all due respect to them, they're not informed on necessarily the significance of the nervous system. The nervous system controls the function of your body. So if there's misalignment there and your colon's not functioning, they may make the decision to send you for a test. They put the colonoscopy up your rectum, or they send something down your throat. They notice you may have some inflammation, so they write a prescription for the symptoms to manage the symptoms of your body not functioning, because the switch is off, let's just say, to your colon. What's so fascinating, Deb, is that you could have a switch off anywhere in the body. And if you have a switch, so if you wouldn't mind handing me that model right there.
No, I won't.
Now what this model is that this is the first vertebra in the spine, and then this is the second vertebra in the spine, okay?
Okay.
So this is a big version of that. So what I want everybody to see is your spinal cord literally is right inside of here. So if we're looking at the spine from the side, and let's say we have somebody that comes into our office, Deb, that head is in the forward position like this. So if somebody comes in and their head is like this, what's happening is that their spinal cord, their spinal column is going forward and literally choking the nerves. But this is the second vertebra right here in the neck. I know from my experience that this vertebra, when I take an x-ray, so when you make the wise choice to come into our office as a new patient, that vertebra, this second vertebra, should be flat, and this one should be angling at 30 degrees. If you come into the office and that vertebra is tipping down, let's say at a minus 10 or 20 degrees, I know the ramifications is that vertebra is subluxated, affecting the nerve, Deb, that goes to your sinuses.
Wow. Or any other part of your body,
But
Dr. Bob.
main switch for that particular spot right there for that one. But you're right, Deb. That whole body below that can get squeezed.
Wow. You know what, Dr. Bob? I think that right now I want to show them a couple visuals. And part of it is going to be group participation. So if you're there with other people in the room watching television, what I want you to do is listen very closely. We're going to go through a few exercises because we want you to participate with us so you can see the importance of what a chiropractic does for your everyday life. Now, if you're there by yourself, don't worry. Take these notes down, and when you're with somebody, I want you to do that. But there are a few things you're going to do by yourself anyway. The first one, Dr. Bob, is they can take the wrist of somebody, and what you want to do is you want to gently squeeze it tight and put pressure on their wrist area. I've got one hand twisting one way and the other hand twisting the other way.
You're enjoying this, aren't you?
Oh, Dr. Bob, please. If you would think about it, after a period of time, his hand, his fingers are going to start to tingle. Actually, they're going to change color.
They are.
They are, because they're not getting the source from what they need, the blood flow, the source, the energy from the rest of what the messages are coming to tell the fingers what to do. So in turn, the subluxation is like this crunch part right here with my hands. It's turning off the correct flow to, for example, your finger area, and that's what's going to start first. Well, what's really interesting is you're going to get symptoms. So whether it be your finger tingling, or whether it be, I didn't go to the bathroom today, or whether it be, I had some indigestion after I ate. All of those are symptoms of something deeper. Now, before I go into the next one, do you want to add anything on there, Dr. Bob?
Well, I think what's so important that we want to go almost all the way back to the beginning of the program and say this. When God breathed life into Adam, he breathed life, spirit. Your body has the ability to heal itself. So if you make the wise choice to come into our office to have an assessment, Dr. Bob and our team, we don't heal you. We turn the vertebra back on, the messages back on, so your body has the innate ability to heal itself. So healing, now listen, so profound, and what separates what medicine does and what chiropractic is. Your body heals from the inside out. Would you say, Dr. Bob? Your body heals from the inside out. When you take an antibiotic, that's outside in healing. Your body has the ability to create wellness itself. We just have to eliminate interference. And as a side note, Deb, and I don't mean to throw your thought pattern off, I've been getting more and more research that they've been saying if a child has a fever or a cold or an ear infection, guess what you're supposed to do? Nothing. Let it go for 2 or 3 days. And right now, if you're listening to us and you have a chronic cough and you think you have pneumonia, viral pneumonia is not going to be impacted by taking a drug. Now, bacterial pneumonia, which means you probably have a temperature, is a little bit different and serious. So you have to be logical in the amount of medications that you're putting in your body. But Debbie, what also is so significant today, and this is why you and I are so involved in food, if you eat conventional food, that means not organic food, you're eating food that has chemicals in it, even antibiotics. And that's their concern today. We're exposed to so many chemicals and drugs, Deb.
You know what, Dr. Bob, we are, and that makes a big difference in how we run and take care of our life. And you know, we have so much more. Yes, we have that participation part of the program that we want to go back to, so you yourself can see how your spine really is. We're going to take a short break. Call someone on the phone. Tell them to be watching us, and we'll be right back.
Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our Half Off Health program. And tonight we are just talking about basic information, life and death. I don't mean to poo-poo this, that it's just basic. This is life and death issues. You know, we talked in the first segment about subluxation. Subluxation is when a bone goes out of alignment and puts pressure on sensitive nerves. Guess when subluxation starts? It starts with the birth process. Were you a forceps baby? How do you know if you're a forceps baby or not? Well, you can ask your mom. If your mom's not around, you can look at your nose. Do you have a deviated septum? Chances are they put the clamps on your nose and literally broke your nose. Or do you have ridges on the back of your head? So that birth process, for some people, could be very traumatic. You might say, well, I was born with C-section. They did surgery to take me out of my mother's uterus. Well, C-sections are actually more traumatic to the spine than natural childbirth going down the birth canal, because when you go down the birth canal, the vagina is contracting, causing the muscles in the child's neck to be supported. So what was your delivery process like? You know, I'll have somebody come into my office and they'll say, Dr. Bob, I have been sick. When somebody says this to me, I've been sick my whole life, guess what? I know that they probably had a traumatic birth from the beginning of their life, or they started eating whole foods too early, or they were immunized.
Well, Dr. Bob, you know what is, I don't want to say the word scary, because that's not true, because we know that there is an answer to all this. But what causes ill effect in your life, which we're going to look at a few things right now, is that these things are not taken care of. And over time, gravity will push down on your spine, causing really, again, ill effect to your whole health system. You won't experience wellness. Now here's something that you can do with the person that you're sitting next to, or have somebody check you if you're there by yourself next time you see them. And you check them, of course. Dr. Bob showed one. How many of you, you know, any time of year you could really analyze people going to sit somewhere in a park, in a mall, in a restaurant, and just see how other people are. Oftentimes people or yourself are sitting with your head totally off your body. You have to understand in that position, what I'm doing right now has to be choking. All of those vertebrae are choking that spinal cord, and there's no messages getting down. So everything your body, all the symptoms your body is having is really the effect of your posture. Well, then you have rounded shoulders. So maybe your head is actually sitting back on top of your body, but you're walking around like this. Then you actually can watch people or look at yourself right now and the way you're sitting. Is your shoulders back? Are you holding your head erect? Can you even hold your head erect? These are signals to us that your posture, there's something going on. And if your posture's off, your spine is off. Dr. Bob, what would you like to add?
Well, Debbie, it's kind of interesting because as you were doing this, I was cringing at all that. But we see that. We see individuals that are hunched over like this. But you know what else is going on with them, Deb? Their lungs are being compressed. And when your lungs don't have vital capacity, that means they don't have enough oxygen. And oxygen is fuel to the fire in your body. We've had patients that have come in and said that their posture's improved and their energy's improved because, see, your body's doing everything that it can to keep you erect. And if your body's in a constant state of this, your brain is trying to do everything. Because, see, to go forward requires no energy at all. This requires enormous energy. When somebody makes that wise choice to come into our office to be checked and have a subluxation checkup, then we start to correct their subluxation. Not only do their sinuses improve and breathing and digestion and all these other areas, which you maybe have never even heard of before, because remember, your nervous system controls the function of your body. So if you're taking medications right now, and I don't have a license to take you off your medication, you always talk to your prescribing healthcare provider. But if you are really wise, you would go with this team approach with a natural wellness doctor. This is exactly what we do in our practice with your conventional medical doctor and work together, improve your posture, change your diet. Because you know, Deb, this is something I want to just allude to briefly. What you eat. So gravity, remember, gravity continually and relentlessly pushes down on top of you. But what you eat can cause a toxic subluxation. See, we have all these organs that are inside of your body. And if this one organ right here, let's say it's your pancreas, is being irritated because you're consuming too many chocolate bars, it's going to send a message back where it gets its electricity. So I know there's someone watching me right now that's probably eating a candy bar, Deb, and drinking a soda pop, and their left neck always hurts. That's because you have what we call a visceral organ somatic muscle subluxation. So if you have chronic left neck and shoulder blade pain, I would minimize and eliminate bananas, raisins, and grapes. Bananas, raisins, and grapes, they're not bad food, but you're consuming too much sugar. If you're eating donuts and pastries and cookies and soda and sweet fruits, you could have visceral somatic subluxation. Very serious, Deb.
It is very serious. Dr. Bob, do you know that you can live without food? It's actually been 3 or 4 weeks that people could just drink water and eliminate food from their life. And if you've ever watched the television show Survivor, you see that they function without very little food. So we can do that. We can live without water, especially depends on the temperature out there, but we can probably live without water for about 7 days without giving our body any type of refreshment. We can actually live without air, sometimes up to a minute or 2, depending on what your lung capacity is. But you can't live, Dr. Bob, if your nerve is severed.
That's right.
It is instantaneous death. So we're actually slowly, by having subluxation, adding a negative to our life. We are taking life away from us. That's why in our office we're so successful. From the womb, we have people come from right from the hospital with their babies to the tomb. We have 90-year-olds coming in for chiropractic care. We see life restored.
Well, Debbie, it's so fascinating when you start to really get the big idea of what's going on. That's the whole purpose of this program tonight, is to help educate you, because I know that you're sitting on a couch or sitting in a chair somewhere in the world right now. You're just scratching your head saying, I wish someone could just figure this out. And that woman I was telling you about the other day, that she should come into our office to be checked, she was discouraged by her medical practitioner for coming to see us. 13 years she suffered. And I know, because you've seen so many guests that have been on our program before that just talk about the miracles of subluxation correction, their body starts to function optimally. You know, there's been so much research. Back in the late 1980s, there was a Dr. Perot that did studies on chiropractic patients, and he used them as their wellness model compared to people which were considered well, and that the chiropractic patients live longer. Their immune system is much stronger. We know that through research and doing blood tests on individuals that a white blood count will increase when you get a correct subluxation adjustment. I also know research has been done, it was released just a couple of years ago, that a chiropractic adjustment to this upper vertebra here in the spine, which is called the atlas. So your spinal, the lower part of your brain stem sets right up here. If your brainstem is getting choked, like I was telling you, well, they've done studies with a chiropractic adjustment where you correct this subluxation, and we use what we call a toggle correction. It's the way we do our spinal adjustment. You can lower one's blood pressure 17 points with a properly applied chiropractic adjustment. So I know that some of you may say, well, Dr. Bob, how can I check? You know, Debbie, we talked a little bit about off camera with the posture. And what you could do right now, we're trying to make this a little bit interactive with you. And if you have a mirror in your room where you're watching television right now, if you're watching this on a computer, you can do this after the program. What we usually have our patients do is close their eyes and take their head back and forth, left and right, and then we have them look straight ahead at me in the practice. So let's just say that their head is tilted like this. I'll know that their head is off to the right, their shoulders high on the left. And what's so amazing, and Debbie, you talk about this a lot, if your shoulders or your head's off and your shoulders high, that's what it's going to show on your x-ray. But Debbie has said in the past, it's just like people are so concerned about their smiles, they'll spend thousands of dollars to get their teeth straightened, but they don't think anything about their spine. And your spine is so much more important than your teeth, because if your spine is not functioning optimally, your brain is not able to send those vital messages down. It's really intense, isn't it?
It really is intense, Dr. Bob. And I do want you to know that you have to do that very quickly when you're testing yourself, because really, your body actually tries to move to a proper position so it looks like you're straight. That's why you want to keep your eyes closed and quickly look in the mirror. You'll get a correct spinal look.
One last thought before we do our close. What happens is, if you got traumatized like this, watch me, your body will do that. It'll do whatever it can for compensation. You know, you could be watching us anywhere in the world right now, and you have been suffering with chronic health problems and don't know what to do. Well, we broadcast live in our office every Wednesday at 12 Eastern Time. It's a program called The Half Hour of Health. You can log on and participate with us. It's interactive. You can type questions, but you can watch us live, and we're there to make a difference inside of your body. You could also come into the office. You know, we have patients that come to see us from all over the world. If you've been suffering with chronic challenges, why don't you call the office? You know, we normally charge anywhere from $165 to $200 for an exam and an x-ray. We'll make that available to you today for only $25. What a great opportunity. We'll do an assessment. We'll sit down and we'll talk to you. We'll take your blood pressure. We'll look at your posture. We'll take films of your spine to determine the exact level of subluxation, and we will apply the correct adjustments to help improve your function over time. It's all about time. It's not going to go away overnight. Remember that gravity continually and relentlessly pushes down on top of you. If you're tired of taking medications, why don't you talk to your healthcare provider? Talk to us. Let's create a strategy to help. See, we're into wellness. We're not into sickness. If we can help you get well, you're going to stay well. You're going to save time, money, and energy. You're going to be a pleasure to be around. You're not going to have fatigue. You're not going to have pain. Get on the fall. Give us a call today. You'll be glad you did.